We are now to the part of microbiology where we start to talk about infections that are caused by microorganisms. Many microorganisms can cause infections. Fungus can cause infections, bacteria causes infections, so do viruses. But remember, we have a vast majority of microbes that are good for us. Our normal microbiome, our normal virome, those all protect us from pathogenic microorganisms. So keep that in mind. We're going to talk about some of the most common infections. We are not covering all infections in this class, but we are going to talk about quite a few. And please remember that the PowerPoints and your homework will be really beneficial for you to look at for the upcoming case studies that you need to write, for the quizzes that you are going to do. It's really important that you look at the material and see just what I'm looking for. So let's begin. Chapter 21, Skin and Eye Infections. Our integumentary system, our skin, is an excellent defense for us. It helps to protect us in many different ways. We have multiple layers that compose our skin. And what's interesting about it is that it can replace itself every 28 days. On the surface of our skin, we have a normal microbiome of staph. We do have staph on our skin because it's salt-loving. Our sweat is salty, and some good bacteria like salt. Remember, staph likes salt. But our salty, sweaty skin is also antimicrobial. In addition to that salt component, it contains sebum and oils and fatty acids. It contains lysozymes, and all of those can have an effect on microorganisms. Lysozymes can hydrolyze peptidoglycan. The fatty acids can also inhibit some pathogens. The sebum can decrease the pH. Remember, bacteria have to have certain conditions that they can thrive in. Some can't handle certain levels of pH. They can handle things that are more alkaline but not acidic. So our skin is an excellent defense. Here is an excellent image showing the normal microbiota of our skin. In addition to staph, we have all kinds of different types of microorganisms that are found on our skin when our skin is healthy. And it's pretty amazing that there are so many different types, and they can be found in specific regions of our skin. So I think this is really a good image to show you that we have a lot of microorganisms that can help us, and they can be found on our skin. There will be quite a bit of terminology as we study this infectious disease part of the class. And these are the particular words that are associated with lesions and rashes. This is the terminology that you will need to use when you write case studies, and these will be terminology words that you will need to understand when you are taking quizzes and might read about them. Refer back to these lesions and rashes definitions so that you will know what's being talked about. So the first one is crust. A crust is dried sebum, pus, or blood. It's a combination of both skin cells and debris. It's dry, it's cracked. A cyst is an encapsulated sac, and that sac can be filled with different things, from fluid to pus to even gas. A macule or a macular rash is very important to understand in both this chapter and some upcoming chapters. So a macular rash or a macule is a smooth red spot. There's no fluid, and you will see some photos of this coming up. A papule is a small raised bump, kind of like a pimple. A pustule is a small pus-filled lesion. You can kind of see that visible pus in that filled lesion. An ulcer is a very painful open sore. A vesicle is very small and it's fluid-filled. A wheal usually is connected with a type of an allergic reaction. It's swollen, inflamed skin, it itches, and it burns. Here are some images from your textbook that represent those types of lesions. These are diagrams, and the following slides will have photographic images. So you can see in these diagrams, these images, you can see how the cyst has that fluid in it and that pustule has that pus. You can also see how that ulcer is open. It's a very painful type of lesion. Here are some of those photographic images that will help you to recognize rashes and lesions. You can see in that image of the crust that it is dried up sebum or dried up pus, or it can be dried up blood. It's left like a scab to it. It contains skin cells and debris. In that cyst, you can see that it must have some fluid in it. If it was yellower, it would probably be pus within that cyst. That looks like it has fluid. But remember, a cyst can also have gas within it. It's very important for you to identify that macular rash, macule. It is that raised red rash. It does not have fluid. You can recognize a lot of infections, not just skin infections, by this macular rash, and you will see it come up in a number of chapters. And then we have the papule, and it does look kind of like a pimple. Here are some more helpful images. That pustule, you can see that it's kind of has a colored fluid in it. That pus usually has a yellow tinge to it. That ulcer is an open wound. It's an open sore, and they're very painful. Vesicles also have fluid in them, but they're generally small. And that wheal, that's the one that is itchy, it burns, and oftentimes it's associated with an allergic response. Rashes can occur from many different things. Of course, they can occur from infections. We can often identify infections based on the type of rash it is. You can have rashes caused from an allergic reaction or a medication reaction. You can have rashes from toxins that get on your skin, or you can have a heat rash. And we can also have rashes that are caused from immune system disorders. Rashes are caused by many different types of microorganisms. They often occur in children, and they are often self-limiting, which means we don't necessarily need to get a prescription medication to heal a rash. Rashes most often will take care of themselves. You will get better on your own. Sometimes you can put some types of creams on a rash, like on a diaper rash, you can put on a cream. If you have a rash that's caused from something like poison ivy or poison oak, you could put on a cream and that will help it. So there are things you can put on there, but they're self-limiting, meaning that our body can take care of that rash, usually. Rashes can be classified as either exanthem or enanthem. An exanthem is an eruptive rash. It's usually non-spreading. It arises from another focus of infection. It's like a breaking out of a rash. It's outside of the body. It's on the skin. Rashes from infections like measles or chickenpox, smallpox, rubella, those are all exanthem rashes. They are on the outside of the body. Chickenpox can also be inside the body, and we'll talk about that next. Enanthem rashes are when the lesions from the rashes occur on the mucous membranes. They are much more serious because they have entered into the body. Coplic spots can be seen inside the mouth from measles. There's going to be an image of that coming up. Scarlet fever is inside, causing what's called strawberry tongue. And when we talk about scarlet fever and diphtheria in the next chapters, you will see an image of strawberry tongue. Sometimes chickenpox can be inside the body as well and move inside the body to the mucous membranes. This is an image from your textbook that really represents that macular rash in A. Measles often presents as that macule, that macular rash. And it starts on the face usually and moves to the extremities. It moves to the arms and legs. And it's got that raised red appearance, but there's no fluid in the rash. It's just a raised red area of rash. And then you can see inside, you can see those coplic spots that sometimes are an enanthem rash that is on the mucous membranes when you have the measles. And then there's an image of a measles virion. There is more than one type of staphylococcal skin infection. So there's more than one type of staph that can cause a bacterial infection of the skin. The two that we're going to talk about are Staph epidermis and Staph aureus. Staph epidermis is a gram-positive cocci that's coagulase negative. Coagulase is an enzyme that causes your blood to clot. Staph aureus is a gram-positive cocci that when it's tested, it's coagulase positive. So that means that it has the coagulase enzyme that causes blood to clot. It also has leukocidin. What's interesting about leukocidin is it can kill white blood cells. It's an enzyme that can kill our white blood cells. So if you have an infection and your immune system is trying to fight it off and it's sending white blood cells to the area to phagocytize that bacteria, the leukocidin enzyme within that particular type of Staph aureus will attack the white blood cells and kill them. Staph aureus can also have an exfoliative toxin. This exfoliative toxin causes the skin to peel off in sheets like a really bad sunburn. And that type of exfoliative toxin causes the skin to peel off, and no lotion is going to help that to heal like a sunburn. It strips the surface and destroys the cells. And so it's very difficult to help that area to heal with just simple lotion like you could with a sunburn. This is folliculitis. It's where Staph aureus has infected a hair follicle. Usually it can resolve by itself, which means it's self-limiting. And it's specific to the hair follicle. Oftentimes, an infection like this occurs due to hygiene or environmental conditions that has caused it to occur within the hair follicle. In the slide before, we talked about staph in a hair follicle. This is staph that has entered into the eyelash, Eyelashes are thicker, coarser hairs. And so this is a type of folliculitis, but it's specifically called sty. You might have heard of a sty that you got in your eye, and it is a staph infection of the eyelash. Usually this is self-limiting as well. It can resolve on its own. You might need eye drops. It's more sensitive when you have the sty, that is the infection in your eyelash area. So one thing that causes these types of infections to occur is touching your face. When you are spreading bacteria into your eye, you're rubbing your eyes. Sometimes makeup or cosmetics can clog the follicle areas within the eyelashes, and a sty can occur. There's many different reasons that a staph infection can occur in the hair follicles of just your regular hair or your coarse eyelash hair. These are images of furuncles or boils and carbuncles, which are clusters of boils. A furuncle is an abscess. It's often pus-filled. It can be an abscess of a follicle. It's surrounded by inflamed tissue. You can see that both of these look inflamed, both the furuncle and the carbuncle. The carbuncle are many furuncles, so it's more inflamed and more serious of an infection. The carbuncle can be deep. It can again have pus. It is a collection of these boils put together. It can be extensive, and it can invade deep into other tissues. And you can see that you need to look at that surrounding red area and monitor that infection. The more serious the infection is, the wider that red area can become. Oftentimes when we have lesions like this, we will measure the infected area and see if it's extending into other tissues or spreading. Also, we need to be concerned here about whether it's becoming systemic. If it is able to access the bloodstream, a furuncle or a carbuncle can cause things like sepsis. These can be very aggressive lesions, and they can go deep into various types of the tissue that they are able to reach and cause very serious types of infections. But you must monitor them and look at the margins of that infection. Look at the red area of that infection and monitor it for spread. Some additional Staph aureus infections that we are going to look at specifically are impetigo. So impetigo is caused by both Staph aureus and something coming up that we're going to talk about. But let's focus on Staph aureus for this. So in this particular Staph aureus infection, impetigo can occur in newborns to adults. It causes these crusty, rash-like scabs to form around the mouth, the nose area. They can rupture and weep and bleed. There's many different things that can occur from these crusts, especially in children because they might pick them. Impetigo again has more than one cause. This one in particular is Staph aureus that we're talking about. It's common in children. Children don't have a fully developed immune system, and so they can develop these crusty lesions on their mouths. Scalded skin syndrome is also caused by Staph aureus, and we talked about the exfoliative toxin that Staph aureus can have. It causes a condition called scalded skin syndrome, and it causes the skin to peel off in sheets, and it looks like this very terrible burn. It's very, very painful. What's interesting about this infection is that we need to be very aware. This infection, this scalded skin syndrome caused by Staph aureus, can sometimes be misdiagnosed in children. And sometimes a good healthcare provider who means well might be considering that the child has come in and has been abused. But we have to make sure that we culture and see what is causing this infection and make sure we have the right diagnosis. Remember, misdiagnosis happens many, many times in many types of infections, and we want to make sure we have the right diagnosis when we see this very red, painful lesions that are occurring due to this exfoliative toxin. You have to do lab work, and you have to make sure what is causing the infection. Toxic shock syndrome is another infection caused by Staph aureus, and we're going to talk a little bit about it here, but we're going to talk about it much more when we get to the genital urinary infections. So toxic shock syndrome caused by Staph aureus is an infection that can spread throughout the body. It causes a tsunami of toxins to occur in the blood. Toxic shock syndrome can be fatal. It is a very serious infection. Oftentimes, you might have heard it associated with the continued use of tampons during menstruation. And so that's why we're going to talk more about it in the genital urinary section. Here is an image of impetigo, and you can see those little dried scabs near the mouth. They're crusted over scabs that might have watery serous fluid, they might have pus, they have little ruptures, they're crusty, perhaps they're bloody, they can be honey-colored, or they can be more red. It depends on many different factors how they appear, but they always have this crusty appearance. And this is the impetigo caused by Staph aureus. There are also many different types of streptococcal skin infections. We looked at staph, and now we're going to look at streptococcal skin infections. There are other infections caused by this particular bacteria that we are going to look at in another chapter. But first, let's talk about Streptococcal Pyogenes. This is a specific type of bacteria that has specific things about it that can increase the risk for infection. If you look at the word itself, Pyogenes, that means that pyo means pus generating. Streptococcal, you would be able to identify the shape and the arrangement. Now, a lot of strep is normal. It is found in our normal microbiota, but it can become opportunistic. It is beta hemolytic, which means that pathogenic strep can break down blood cells. If we put strep that is pathogenic on a blood agar plate, it will clear out that particular area where we grow it on the agar. It will wipe out all of the blood and produce a clear area, and we will know that it's pathogenic. It has many different types of serotypes, and some are pathogenic. Streptococcal Pyogenes with serotype A is more pathogenic. If you haven't had A&P and don't know what a complement system is, a complement system is part of our immune system. It's a structure that can neutralize microbes invading infection caused from things like bacteria. It can fence around the infection. And it's activated as an antimicrobial response. It is meant to attack certain types of bacteria. Streptococcal Pyogenes has M proteins that can prevent the activation of this protective part of our immune system. It can prevent it from fencing it in, from stopping it from causing an infection. There are many different things that bacteria have that can help protect them, that they can have virulence factors, and Streptococcal Pyogenes has quite a few, and these are the first ones that we're going to talk about. Streptococcal pyogenes can cause infections that go deep into the dermis, and they cause a very red, really angry looking type of rash to occur and an inflammation that can spread. S. pyogenes is the other bacteria that can cause impetigo. We talked about Staph aureus, and also impetigo can be caused by streptococcal infections. So S. pyogenes can also cause impetigo. And again, it causes those crusty, ruptured rashes to occur around the mouth, the nose. There can be pustules that rupture and be crusty. And it looks very similar to Staph aureus infections that occur. And so you, again, have to culture to see what type of bacteria is causing a specific type of infection, because you want to treat it the right way. So knowing that one type of infection can be caused by two totally different bacteria, you can see how important it would be to culture it and see what actually is causing this rash and these lesions to occur. Let's talk about invasive group A strep infections. We talked about how there are different serotypes of Streptococcal Pyogenes. There can be A to T. A is very pathogenic. It can be very aggressive. When I see A, I think aggressive. The thing about this type of strep infection is that this type of strep has different types of enzymes that help it to get past the body defenses of the skin and deep into the tissues, the muscle, and the fascia. And they can sometimes cause fatal infections. It has streptokinase and hyaluronidase, and both of those can help it to move through tissue. It also has an exotoxin A, again, think aggressive, and this is very, very pathogenic. So the first form of invasive group A strep is cellulitis, where group A strep will attack the solid tissue. It attacks soft tissue. If it moves deeper to the muscle, then it is called myositis. It attacks the muscle. Myo means muscle. It can also continue to spread and cause necrotizing fasciitis. This is the most severe. You might have heard when news stories or read articles about flesh-eating bacteria. Oftentimes, it will go back to this invasive group A strep. You can start with a small scratch or a cut, and it can become this very serious infection that spreads throughout the fascia. The fascia is very fragile and it is able to allow that bacteria to spread and cause a lot of damage. And sometimes it will cause the patient to have parts of their body amputated, or again, it can become fatal. There are many different types of Pseudomonas infections. They can be caused from Pseudomonas aeruginosa, which is a gram-negative aerobic rod. That means, remember, it needs oxygen in order to thrive. It also produces a characteristic, identifiable blue-green pus. It's very specific to Pseudomonas aeruginosa. It can cause things like Pseudomonas dermatitis or hot tub folliculitis. Hot tubs can spread a lot of different types of bacterial infections. And if you look at that, folliculitis, that means that the Pseudomonas got into the hair follicle, right? From you sitting in a hot tub that probably wasn't particularly cleaned well. You can also get an infection called swimmer's ear or otitis externa, and it can get inside of the ear when you're swimming and cause an often painful infection. Post-burn infections are very serious infections that can be caused from Pseudomonas aeruginosa. Burn patients are very susceptible to infections, and this can cause a very serious infection within the burns, and it can often cause a fatal infection. Also, Pseudomonas likes to take hold and cause infections where there is little circulation. So you can imagine if a burn patient was very severely burned, that there would not be good circulation to that area. Also, diabetics do not have the best circulation and are often susceptible to Pseudomonas infections. Remember, too, that Pseudomonas infections can occur because Pseudomonas is so resistant to so many different things. It's resistant to different types of antibiotics. It can live in bleach. It is able to be chemically resistant. Sometimes with infections like these, you have to think outside the box and think of different ways that perhaps you could treat this infection. If you look at Pseudomonas aeruginosa, again, it's an aerobic rod. What if you were able to treat it by removing the oxygen in a hyperbaric chamber? That is one way that we are trying to think about treating these types of infections, by looking outside of, yes, they can resist antibiotics, so we have to find another way to treat them. Here is an example of that very characteristic blue-green pus, and you can see that it is occurring between the toes. And so this is someone who probably has very poor circulation, perhaps a diabetic, and this infection has taken hold and is producing this blue-green pus. But we can identify it based on what it looks like, as well as culturing it and identify the type of bacteria that is causing this infection and try and stop the spread before this patient has to have any toes amputated. Our skin has that great defense of sebum, and that sebum can be antimicrobial. It's acidic, it can lubricate the skin and hair, but it can also overproduce and clog the pores with shed cells. It blocks the pores with shed cells and sebum and causes comedonal acne. Now, a treatment for this type of acne would likely be better hygiene. Washing your face, maybe using witch hazel, using over-the-counter products to help to rid the pores of this built-up sebum and shedding skin cells. Inflammatory acne hurts more, you're at risk for an infection. Oftentimes it's treated with antibiotics. broad spectrum antibiotics usually, which can also cause problems for us in the future. A lot of people are on antibiotics for their acne for extended periods of time, and what can happen is that it can affect the normal microbiome. Because it's usually treated with broad spectrum antibiotics, it kills a lot of bacteria. It can kill gram-positive, gram-negative, all kinds of different types, not just the type causing this inflammatory acne. A lot of times in the past, tetracycline was used as the antibiotic of choice to treat inflammatory acne. You can use peroxide. You can also use visible blue light. Visible blue light has been shown to help to treat inflammatory acne. Years ago, people would use tanning beds to help to treat their acne. That is not a good idea because you need to consider skin cancer and things like that. So inflammatory acne is a difficult condition to treat, but there are ways that you can treat it with limited antibiotic use. Nodular cystic acne is the more serious type of acne. It can cause deep scarring infections, and this is treated with Accutane. It is a specific medication for this specific type of acne, nodular cystic acne. It's not just where the pores are clogged. There are other things that are happening within this type of infection that is occurring. But if you are treated with Accutane, you must also take a birth control along with this Accutane, because Accutane can have serious side effects. And so females have to say that they are going to take a specific type of birth control in order to prevent their babies being born with birth defects. This is a very serious type of medication, and you really have to weigh whether you want to take this type of medication that can have these very serious side effects for you or an unborn child. Bacillus anthracis, think anthrax. Anthrax or Bacillus anthracis is gram-positive. It's an endospore-forming facultative anaerobe, which means it can grow in both oxygen and it can also grow anaerobically. Prefers oxygen, but it can grow anaerobically. It is found in the soil. Oftentimes, it will form endospores and be in the soil. It also has been found to have a zoonotic transmission, which means it can be transmitted by animals. When it is cutaneous, it can enter through the skin, through abrasions. This is the most common type of anthrax infection. You can be out gardening, or you can be working in the soil, and you can have this Bacillus anthracis enter through a cut or a skin abrasion that you have. And once it's inside, remember, once it finds the conditions that help it to be a perfect environment, then it will come back to life and cause an infection. Remember that endospore is like a protective state that it is in. Cutaneous anthrax has about a 20% mortality, and as it goes up through gastrointestinal ingestion to inhalation, the mortality rate also goes up. When you ingest this bacillus, it causes about a 50% mortality rate. Sometimes Bacillus anthracis can be in honey. You've probably seen warnings where children should not have honey under the age of 2. This is one of the reasons, because Bacillus anthracis could be in the raw honey. So you have to be very careful. You can also inhale anthrax. Anthrax has been used as a weapon, and people have been mailed anthrax in the mail in this powdery form, or somehow they have inhaled it. It has a very high mortality rate. Once these endospores enter the mucous membranes and get to the lungs, they can be fatal. And because the environment, that wet environment of the mucous membranes and in the lungs, is a perfect environment for that endospore to come back to life and cause an infection. You can also introduce Bacillus Anthracis through injection. If you are an injection drug user, if you use heroin and things like that, sometimes you can inject Bacillus Anthracis into your puncture wound site. So these two images in A, you can see that is a cutaneous infection of Bacillus Anthracis, of anthrax. It forms like this black wound that can occur. And remember, that's the has the least mortality, about 20%. It still can be fatal, but the fatality rate goes up as you enter the body. Conjunctivitis or pink eye has many different causes. They can be bacterial or viral causes. It can be an allergic reaction. We might have wiped some toxins into our eye from poison ivy or poison oak. Things that we have touched, we put in our eyes when we are rubbing our faces and touching our eyes, and we can cause infections like conjunctivitis or pink eye. It infects the very thin membrane called the conjunctiva, and it can cause this weepy infection and very red, inflamed, burning sensation in our eyes, and it's easily spread to other people, so we need to wash our hands and make sure that we're not touching other people when we rub our eyes because of the itchiness or the pain that we're feeling from the conjunctivitis. It usually can resolve in a few days, which means, again, it's self-limiting, but because it's so itchy and inflamed and often painful, you may need to have analgesic drops that can help to ease the pain of this infection. But it is often a common infection, and many of you might have had it. Warts are a superficial mass of hyperkeratosis. They are built up from the human papillomavirus, and there's 150 different types of species of this virus that causes many different types of warts. They can vary in the way they look, in their shape, and their location. They can be on your feet, your hands, they can be on your genitals, they can be all kinds of different types of warts. We are going to talk about warts in the genitourinary infection section, that we're going to talk about those types of human papillomavirus infections, and some of them can be fatal. These are specific to skin. They can be common, they can be plantar, which is on the bottom of your feet. Sometimes warts are flat, or they can hang like a skin tag. They can be filiform. They can look all kinds of different ways depending on the species of the virus that is causing it. Warts can be asymptomatic for a long time. You treat them and you think that they've gone away, but in actuality, it's a virus and it's living in your skin or it's living in your mucous membranes, and it's able to return. It's a latent type of virus that can come back again after a period of time. It can be very painful to treat warts. They freeze warts. They use very strong chemicals to burn them off. People use folk remedies from duct tape to banana peels, trying to rid themselves of warts. It can be a very embarrassing type of thing if you have warts on your hands. Warts are also transmitted skin to skin, so you can directly transmit a wart from your hands to someone else's. So you need to be very careful if you suffer from warts so that you don't pass it on to others. But know that warts are caused by this human papillomavirus, and there's a vast array of different types of warts. This is an image of a cold sore from the herpes simplex virus 1. There's an additional herpes simplex virus 2 that we will talk about in a later chapter. We've talked a little bit about this before when we've talked about latent viruses or lysogenic viruses. This is one of those type of viruses that can replicate in the epithelium layer of the skin. It can infect nerve endings. It can become latent and lysogenic. It can have a period of time where you're asymptomatic, where there are no symptoms, where you have no cold sores, and then something activates that virus to start replicating again. Remember how that lysogenic cycle can turn into the lytic cycle. So it starts to replicate again under some sort of trigger. Stress or a pregnancy, something happens. Your immune system is at a weak point. Something causes the cold sore to present itself because the herpes simplex virus 1 was activated again, and it will cause this fluidy, often blistery type of rash to occur around your mouth or your lips. Sometimes it can get into your throat as well. It can take days or weeks to heal, and again, it can become latent and come back again. It's a virus that integrates into your genome, and it's very difficult to get rid of. If your lips get chapped or really dry in the winter, sometimes it can cause cold sores to appear. You can get over-the-counter medications to treat cold sores. Some people who have very serious infection of cold sores that are very difficult to get rid of might take acyclovir. If you remember, acyclovir is specific for viruses. It is not an antibiotic. It is specific to viruses and can treat cold sores caused by HSV1. Some people have also used folk remedies like brilliant green to treat these types of eruptions that can occur around their mouths. But again, remember, this is caused by the herpes simplex virus 1, and it can be latent or lysogenic and occur at different times, and you can have long periods of time, months or years, without having a cold sore, but still have the virus integrated into your genome. Fungi can cause many different types of skin infections that can range from superficial to deep. And you need to know these specifically, these different types of fungal infections. Oftentimes, these fungal infections are caused from an allergic reaction to the spores of the fungus. Remember, that's how they replicate. They produce spores in order to replicate. And when they cause a skin infection, it's because we're having a reaction to the spores of the fungus. You can also develop infections from ingestion of fungal toxins. Remember, we've talked about poisonous mushrooms. So you can get an infection internally from injection. I want to throw that in now because we're not going to talk about internal fungal infections again later on in the class. But let's talk about those surface infections now. Fungal infections of the skin can be cutaneous, which means it just includes the epidermis, the hair, or the nails. It is like dandruff. Dandruff is a fungal infection. And when you use specific types of shampoo for dandruff, those are antifungal shampoos. And that's what they're doing, is they're treating the fungus to get rid of the dandruff. It is just a surface type of infection. It's pale, it's flaky, and it's on the surface. Subcutaneous is infecting the epidermis and the dermis. It is deeper into the tissues. That's for things like ringworm. It is considered to be an intermediate infection. It causes inflammation. It can be red. It can be hot. It can look swollen. That is a subcutaneous infection. We are going to look at some images coming up that will help you to understand these different classifications. You can have a systemic fungal infection, which can be very serious. Remember, when something goes systemic, that means that somehow that infection, that microbe got into your bloodstream, and now it's able to circulate throughout the body. Oftentimes in the term, when we're thinking about fungal infections specifically getting into the system, in going systemic, it means that you've had a infection of the skin, you scratched it, it's bled, and it's created a portal of entry for that fungus to get in and get to your bloodstream and circulate throughout your body. When we talk about different fungal infections, like how do you get these? Think about how you are on a yoga mat or a wrestling mat or something that's not cleaned. You're working out at the gym and there are areas that are not clean. You can pick up different types of fungal infections from places that are not cleaned very well and fungus has been allowed to grow. Cats are something that can cause ringworm. Those are the type of infections that might come from that. So there are lots of things that can cause fungal infections. A lot of times it's due to areas where you're at, in the shower, where you got athlete's foot, something like that, because the area wasn't very clean and someone else had it and transferred it to you, or the fungus was allowed to grow, something like that. This is to show you a list of names of different types of fungal infections, and you can see that they all start with the word tinea. Tinea corporis would be ringworm. Tinea capitis, we can think about scalp. It affects the scalp capitis. Pedis, you could think about athlete's foot, relating it to the foot. You can get a fungal infection in your beard. You can get it under your fingernails or toenails. You can get it in your groin. That's what jock itch is. And again, it can be cutaneous, which is superficial. It can be subcutaneous, which goes past the epidermis into the dermis. It's going deeper. It's more serious. It's an intermediate infection. It's more inflamed. As it goes deeper, it also has access to nerves, and it can become painful. And remember, you can also have systemic fungal infections that can go throughout the body. A subcutaneous fungal infection is A, looks white and flaky, B, looks like inflammation is present in underlying connective tissue or the dermis, C is bloody or scabby. The answer is B. A subcutaneous or intermediate fungal infection looks like an inflammation is present in underlying connective tissue or the dermis. It's gone past the epidermis into the dermis. So the one that looks white and flaky, that's dandruff, right? And then if it's bloody or scabby, a fungal infection can become systemic from the looks of something that looks like that. This infection is A, cutaneous, B, subcutaneous, C, systemic. The answer is A. This is a cutaneous fungal infection. Remember, a cutaneous fungal infection can infect the epidermis, which is the surface layer of your skin, your fingernails or toenails, and it can also infect your hair. So this answer is A. This infection is A, cutaneous, B, subcutaneous, C, systemic. The answer to this is the B, subcutaneous. This is ringworm. So it looks inflamed. You can tell that it's deeper. It's past the epidermis into the dermis. It's inflamed, it's red, it's swollen. That would be an intermediate infection, a subcutaneous fungal infection. This infection is A, cutaneous, B, subcutaneous, C, systemic. The answer is C, systemic. This infection has likely become systemic. It might have started out as a subcutaneous fungal infection, but maybe you scratched it, it bled, it got deeper, it became more infected. You can see the red area is growing around the initial source of that infection. And once it reaches the bloodstream, it can become systemic. So this would be C, systemic. If anything looks bloody or scabby, you have to suspect a systemic infection. This infection is A, cutaneous, B, subcutaneous, C, systemic. The answer is C, systemic. Again, this looks like it's a deep, it's gone past the epidermis, through the dermis, it's deeper, it's probably reached the bloodstream because you can see that it's kind of scabby looking. That means that it bled at one point. You can see that the infection is kind of spreading around up the toes. It's red. It looks very inflamed. This infection is A, cutaneous, B, subcutaneous, C, systemic. The answer is A, cutaneous. This infection is dandruff. So that would be a superficial cutaneous infection caused by a fungus. So you can see it affects the hair. So remember, cutaneous can affect the epidermis, which is the surface of your skin. It can affect your hair, and it can affect your fingernails and toenails. So this is cutaneous. Scabies can cause a very itchy skin infection. It's caused by a mite that burrows under the skin, and it lays their eggs. These eggs will hatch underneath the skin, and also the live scabies are underneath the skin, and they're leaving behind waste products, and all of that creates a very itchy type of infection. 500,000 people a year are infected in the U.S. by these mites that cause scabies. It spreads very easily. In the homeless population, it can spread very easily from person to person. It's very hard to treat. It's becoming resistant to insecticide use. We treat it topically with insecticides to try and kill the mite, because it is a mite that is burrowing underneath the skin. So we do treat it topically with insecticides. But it is becoming resistant, and unfortunately very hard to get rid of. It can be in clothes, especially when we're talking about the homeless population that can't shower, and is not able to get rid of these little mites that are in their clothes or their bedding or their tents. It's a very uncomfortable infection that can be caused by these mites. Infections caused by lice are infections that we also treat with topical insecticides, and these are also becoming resistant to the insecticides that we are using to treat it with. There are different types of lice for your body and for your hair. They feed on your blood. They lay their eggs and the nits attach to your hair. It used to be that children were not allowed to come to school or were sent home if they had lice in their hair. Thankfully now that is not happening, so that children can remain at school so that they can have their breakfasts and their lunch, because sometimes that's where they get their best meals of the day. When they come from lower socioeconomic backgrounds. And so we do not want to remove children because they have lice. What we do is we treat their hair so that we can remove the lice. Sometimes you have to use little combs to comb them out. You have to pick the little nits out. You can also use like a flat iron and kind of heat up the hair and pop them off. But you can't heat them too hot because you can burn them to the hair and make them stick even more. Some people have used mayonnaise to cover their hair to smother them out. Rid-X is used, but lice is now treated so that children can remain in school and they are not sent home from school. Body lice is often prevalent in the homeless population along with scabies. And again, we are treating it with topical insecticides, but it is becoming resistant and can be difficult to treat. This is an image that is showing the nits in the hair that need to be removed that the lice have left behind. All right, let's do some review questions over this chapter. Staph aureus infections can look like a sunburn. A, true. B, false. The answer is A, true. Remember, they have that exfoliative toxin that can cause the skin to peel off in sheets and look like a burn. It can look like a sunburn. It's very raw and inflamed looking because it has that exfoliative toxin. Let's think about the infection that can be either caused by Staph aureus or Streptococcal Pyogenes. Is it A, burns, B, impetigo, C, fasciitis, or D, mycosis? The answer is B, impetigo. It can be caused by either Staph aureus or Streptococcal Pyogenes. And remember that pyo word means pus when you see pyo. Burn infections are often complicated by A, Staph aureus infections, B, pustular rashes, C, Pseudomonas infections, or D, fasciitis infections. The answer is C, Pseudomonas infections. Remember, Pseudomonas can be opportunistic. It can infect the burns of people and cause very serious infections that are very difficult to treat. For the rest of this class, we're going to be doing a lot of case studies. You get to write case studies and you get to read some different case studies and try and figure out what's happening in that case study. So we're going to look at a lot of different examples. This first one, a 7-month-old infant presents with a pustular rash that is somewhat crusted and scabby. The surface skin on their hands and arms is peeling. What is your diagnosis? So there are a couple things going on here, but both of those things could be caused by the same bacteria. A pustular rash that is somewhat crusted and scabby, that's likely impetigo. And that can be caused by both S. Pyogenes or Staph aureus. The surface skin on their hands and arms is peeling, like scalded skin syndrome, caused by the exfoliative toxin that Staph aureus has. So the bacteria likely causing the infection in this infant is caused by the bacteria Staph aureus. So you could have two diagnoses with the same type of bacteria of Staph aureus, but you need to culture to see exactly what it is, especially when it's something like the skin peeling off their hands and arms. While we want to believe that it's Staph aureus that is causing the skin to peel off in sheets because of that exfoliative toxin, we need to make sure that that's what's happening in this infant. A patient suffering from chemical burns on 65% of their feet and lower legs is complaining of pain. Inspection of the feet reveals a blue-green pus oozing from several ulcerative wounds. What is the cause of this infection? The answer is likely Pseudomonas. Pseudomonas produces a very characteristic blue-green pus when it is causing an infection in a wound. And burn patients are very at risk for opportunistic infections caused from Pseudomonas bacteria. A 16-year-old patient complains of frequent small white pimples on their face, neck, and back. What is the specific form of acne, and what is your treatment recommendation? This is likely caused by the sebum and the skin cell shedding building up in the pores. And so this is likely to be that comedonal acne. And the treatment? Good hygiene, washing your skin, paying close attention to your skin, maybe using a little witch hazel on your skin, maybe using a good skin mask to clean out those pores. But this is a pretty common type of acne that is occurring in this specific case study. So that's the end of our skin infection chapter 21.